Hi, I'm Marina Laquio, and today we're going to demonstrate the parenteral drug administration such as intradermal, subcutaneous, and intramuscular injection. This demonstration is a medication that enters the body by injection through the tissue and circulatory system. So the first thing we need to do is check for the doctor's order on the patient's chart to ensure the medication of the client. Then, importantly, greet the client appropriately, introduce yourself, verify the client using his or two identifiers such as his or her name, then birthday. Then ask how he or she would like to call during the assessment. Then don't forget to establish good reports so the client will feel comfortable during the assessment. Explain the procedure to the client on how or she can participate during the assessment. And don't forget to provide the opportunity to the client so that he or she can raise for his or her concerns. Then of course, don't forget to perform hand washing to prevent the spread of microorganisms. Observe the appropriate infection prevention. Arrange the medication drug to the hypodermic train with the corresponding drug to prevent the confusion later on. Then apply your clean gloves to reduce the risk exposure to the blood. Hi ma'am, I'm Marinela Kio. I'm your student nurse. Are you Virginia Arca?
Yes, ma'am.
I would like to know when is your birthday, ma'am.
July 30, 1968.
So for now, we will conduct skin tests for us to know if you have any allergic reaction to the drug. So for now, the first demonstration that we're going to do is the intradermal injection, which is commonly used to perform a skin test or sensitivity test to know if the patient is allergic to the drug. Before we do our assessment, the first thing we need to do is to disinfect or sanitize our hands. So now expose the site of injection. Carefully choose area away from the blood vessel. Disinfect the site using an alcohol swab in circular motion, working from inner to outer direction. So next is place your non-dominant hand under the patient arm and stretch the skin out the patient. This will taut the skin, allowing the needle not to meet any resistance from the skin. Next is place the syringe almost flat on the patient's skin and thrust the needle at 10 to 15 degree angle level. Once below cannot be seen, anchor the syringe and introduce a small amount of solution until a small wheel is formed. Quickly remove the needle and wipe the excess fluid on the skin of the patient. Do not press the wheel. Next is encircle the side of the wheel using a blue or black ink pen and then write the abbreviated name of the drug and time of reading. Instruct the patient, do not scratch and press the wheel. Do not recap the needle. Dispose the syringe and needle based on hospital policy. After 30 minutes, check the wheel. Skin test is positive if there is enlargement of the wheel, itchiness and redness. If positive, notify the client's doctor. If negative, start administering the drug based on the orders of the doctor. Document the procedure. So for the purpose of subcutaneous injection is to get rapid and systemic effect of the drug. Some medicines that cannot be administered orally due to the poor absorption of GI tract. Lastly is when the drug is toxic and irritating to gastrointestinal mucosa. So for subcutaneous injection, the first thing we need to do is to wear our clean gloves and do the sanitation. Next thing is expose the site of infection. Disinfect the site using an alcohol swab in a circular motion working from inner to outer direction. Place a cotton ball with alcohol between the third and fourth fingers of your non-dominant hand. Grab the syringe with your dominant hand and remove the needle cap. Using your non-dominant hand, slightly pinch or spread the site of injection depending on the size of the patient. Introduce a needle 45-degree angle for lean patient and 90-degree angle for patient subcutaneous tissue around 2-inch thick. But for now, we will use the 45-degree angle. Inject the medication. Remove the needle quickly with the same angle you introduced it. Apply a pressure using a cotton ball. And then put your tape. Always remember that do not recap the needle. Dispose syringe and needle based on hospital policy. Make the patient comfortable and document the procedure. So for the purpose of intramuscular injection, the drug is administered by intramuscular route when a more rapid action is required than oral. Lastly, if it giving medication into muscle. For our intramuscular procedure, first thing we need to do is wear our clean gloves and do our sanitation. Expose the site of injection. Disinfect the site using an alcohol swab and circular motion working from inner to outer direction. Place the cotton ball with alcohol between third and fourth fingers of your non-dominant hand. Grab the syringe with your dominant hand and remove the needle cap. Using your non-dominant hand, support the site of injection depending on the size of the patient. Introduce the needle at 90-degree angle. Inject the medication. Remove the needle quickly with the same angle you introduce it. Apply pressure using the cotton ball between the fingers of your non-dominant hand. Always remember that do not recap the needle. Dispose your syringe and needle based on hospital policy. Make the patient comfortable, and lastly, document the procedure.